or tepid sponge bath. This procedure is an important nursing skill used to maintain a patient's hygiene and comfort, especially for those who are unable to bath independently. In this video, I will show the proper steps and techniques in performing TSB while ensuring the patient's safety, privacy, and comfort. To start the assessment, assess the condition of the patient. This data will serve as the basis for evaluating the patient's response to the treatment. The second one is to assess the client's ability to assist in the bathing process as well as the personal hygiene preferences. Review the client's chart for any limitation in physical activities. For the third one, remind the patient to call for assistance when getting up. The combination of the elevated temperatures and sponge bath could weaken the patient. For the fourth one, assess for the presence of external medical service or device and equipment. For example, is the intravenous line or oxygen tubing. And lastly, observe patient for elevated temperature and then review the doctor's order. For the planning, the first one is to bring necessary equipment to the bedside stand or over bed table. The second one, bath must be administered for at least 30 minutes to be effective. The third one is to constant monitoring of the patient's body temperature is essential so that it does not drop below normal. The fourth one, maintain a level of privacy throughout the procedure. The fifth one is to adjust the patient's bed on a certain height that is accessible for working. This is beneficial for the nurse to protect her from straining her back.
Good day, ma'am. May I come in?
Yes, nurse.
So, ma'am, I am PMED Magsino and I will be your nurse for today. Ma'am, I will be performing tepid sponge bath. Is it okay, ma'am?
Yes, nurse.
Ma'am, it is to reduce your body temperature. Is it okay, ma'am?
Yes, nurse.
But first, may I know your name?
Pauline Cristina Alano.
How about your birthday, ma'am?
September 26, 2007.
Alright, ma'am. Thank you for the information. I will just wash my hands and I will come back. Is it okay, ma'am?
Yes, nurse.
Alright. So the first step is to provide privacy for the patient, close all door and windows, and turn off the AC. And then raise the patient's level into appropriate working height for the patient's comfortability. After that, let's take the temperature of the patient. But before that, ma'am, can you please remove your jacket first?
Yes, nurse.
Thank you, ma'am. So now we will take the temperature of the patient. So this will beep after 30 seconds. So the next step is to replace the top sheet with bath blanket. Ma'am, can you hold this?
Yes, nurse.
And then pour water onto the basin. And then the next step is to get the towel and soak it into the water. After soaking the towel, squeeze it to avoid dripping. And then the first step is to put the first towel onto the forehead of the patient. The next one is to the axillary part. And then do it on the other side. And then the last one is on the groin. Ma'am, are you comfortable with it?
Yes, nurse.
So the next step is to put a towel on the chest of the patient. So ma'am, can you hold this? And then we will position the patient into lateral position. So ma'am, 1, 2, 3, go. And then we will place a rubber mat at the back of the patient. So now we will sponge the upper extremities of the patient. So get a wet towel and then squeeze it to avoid dripping. And then do it on the other side. And then we will change the position of the patient into lateral position. 1, 2, 3. And then continue to sponge the back and the buttocks area of the patient for about 5 to 10 minutes. And then continue to sponge the lower extremities of the patient. So starting from the ankle to the knees and then from the knees to the thigh. And then do it on the other side. Continue this process for about 5 to 10 minutes until the body temperature of the patient becomes normal. Now for the remaining dry cloth, pat dry the lower and upper extremities of the patient to avoid chills. And then do it on the other side. Now the last step is to remove the gloves. And then throw it on the garbage.
For the evaluation, the first step is to return all the equipment to storage, clean areas, and change linens if necessary. The second one is to record time procedure was started, when ended, vital signs, and the patient's response.